Welcome back. We are with the Chief Executive of the Canterbury District Health Board, David Mates. Between last September and January, 1,200 elderly have had their home help axed or reduced. And apparently over the same period, 271 people have had their hours increased. How can you be sure you're not being tight-fisted with the oldies?
It's always amazing the spin that gets put on figures.
What's their spin there?
What's been really important is that there's been a lot of noise about home-based support.
Yep.
And one of the things that has ended up happening in Canterbury is a lot of people had accessed home-based support. And we as a health system had not been that good at reassessing and determining, ensuring that the reason people got home-based support, often the rationale and the reasons change. And sometimes there's a lot of people that have more complex needs that they weren't getting enough. Now, one of the big issues, and we had a lot of stories with really healthy people that were out mowing their lawns and their neighbours' lawns, and we were paying for the lawn mowing.
Right.
That's people that would out be playing golf, having their house cleaned. Now, that's not a responsible use of health dollars. However, there are some people that need a wee bit of support to stay and remain in their home, and that's something we do want to do. So all we've gone through is done a reassessment of all of the people, particularly on short-term home-based support, and really to say, well, what was the reason they accessed the support, and is that still valid? And having done that assessment, to make decisions about whether we continue to provide support, whether we cut the support, or whether in fact we add some to that.
Okay.
And as part of that process too is that anyone that disagrees with that assessment has the opportunity to go back and challenge the assessment, and we go through and review that again.
Just a couple of quick things. First of all, Grey Power has highlighted the propensity of pride to be a problem with older people, and they say there'll be cases where the person in question will say, yes, I can manage, when they can't. How can you be sure your internationally validated telephone assessment tools take that into account?
Well, there's two bits. One is short-term home-based support, and that's often, and deliberately only goes in for a short period of time.
Sure.
It's very different from very complex needs. And what we have, and we link in with primary care on that, to have a discussion with primary care about what are the needs and their views and perspectives on that, because they know the individuals far better than we.
By primary care, you mean their GP?
Their GP. So what we're trying to do is work with them to make sure that, in fact, we're not making silly, arbitrary decisions.
Okay.
But the approach we're taking in Canterbury is quite different from what's happening in other parts of the country. And in fact, there's a lot of noise that's happening in other places that is not consistent with the approach that we've taken in this region. Should
family members, should friends, should neighbours be far more proactive in the uptake of assistance to people?
I think we've got a fundamental societal problem or challenge in terms of what do we mean by community. And the best way for people to stay active and engaged in their community is actually having a sense of community, so that neighbours are engaged and part of, that family are also connected with the elderly. And I think often what we're seeing too is where those relationships are fractured or broken down, is that health sometimes comes to the rescue of or provides support that, not necessarily about a health need, but there's other society issues that are going on with an individual or with particular families.
Yeah. I've got about 2 minutes on the clock. I understand there has been a pretty substantial uptake in home help services offered by private providers. Won't Grey Power say that is the proof you need that the Health Board is not providing adequate coverage?
We don't have evidence of that in Canterbury at the moment. But again, if individuals choose to get some cleaning support and things like that, and they're able to afford that, isn't that a good choice?
Sure.
And isn't that a wise choice of health dollars too?
Do you have private health insurance?
No, I don't.
Should New Zealanders with means get private health insurance?
I think that's a decision and choice for individuals, those that feel they're able to afford and that's appropriate. It provides a different and alternative way to receive health services, and for some people it makes absolute sense.
30 seconds. What's the most rewarding and frustrating aspect to your job?
The most rewarding is actually the people and the complexity they work with. We have just a fantastic team. And I think one of the frustrations we have with that is sometimes we don't quite get things right, and that's one of the things that we're continuing to be much more open and much more transparent as a health system. We'll get it wrong. up in front, open about that, but also making sure that we don't continue to repeat the same sort of issues.
Good stuff. By the way, as David referred to, the consultation is still underway over the Christchurch Hospital redevelopment. The period for consultation closes on May 4. Just go to the council website or the Health Board website for details. Thank you very much for joining us, David, and we'll have you back soon.
Pleasure.
Always plenty to talk about.
It certainly is.
David Mates, thanks for your company. Good night.